歡迎大家嚟到今日嘅簡報會。
Welcome to the press briefing. We have Dr. Chuang Suk Kwan, Head Communicable Disease Branch Center for Health Protection, and Dr. Lau Ka Hin, Chief Manager, Hospital Authority. Dr. Chuang will give you an update on cases. Good afternoon. Yesterday, there are 142 confirmed cases. That's a case number 14469 to 14590. 21 are imported cases, 122 are 121 are local cases, and of that, 15 cases carry the L452R variant strain, that's the Delta strain, and 13 cases linked to previous cases, such as cases from Ming Lai House, Chang Po House, and so on. And there are 2 untraceable cases out of the 15 cases suspected of carrying the Delta strain. That's Choi Wen's Estate, Xi Yu House, and then Ping Yu House of Taiping Estate in Shangshui. And then of the 121 local cases, 91 are linked to previous cases, 31 untraceable for the time being. And then for the linked cases, for Shui Pin Wai Estate Picture House, there are 2 units, Unit 1A on 2 floors, so we suspect there's vertical transmission. So our colleagues and other departments have now gone to check the unit, so some residents may have to be evacuated. And then we've recorded another case at the Shing Kong Wui Lam Wu Home for the Elderly at Kwai Chung on Yam Estate, Feng Yam House. The case relates to someone working at a different location. There's no contact for work reason, but then there could still be some transmission. So therefore, some 60 plus home residents have to be quarantined. And then Ma On Shan, the Times Cafe, there are 2 workers who are confirmed cases. So if you've been to that particular restaurant, you have to take the test and you have to watch your condition. And then the London Plaza, 4 workers are confirmed. That is the Chuang's London Plaza, the Sun restaurant in Jordan. 4 staff members are confirmed cases, so the others therefore people who've been there need to be tested. And at Ho Hum, there's a ground floor shop, F9, a fish place. 2 persons are confirmed cases. I understand the FHD has arranged deep cleansing and sanitization of the place. And then we've also seen some family groups. It's probably because of the Chinese New Year, the family gatherings, and that have led to some outbreaks. For unlinked cases or cases the sources of which cannot be traced yet, well, these cases are found in all parts of the territory. First, on New Territories East, Sha Tin, Ho Wan Center, someone living at Chung Wan Court, and then Sha Tin Tao San Chun Village Housing. And then Tai Wai Hin King Estate Hin Yao House, Tai Wai Sun Chun Estate Sun Fan House, Mei Chung Court Heng Chung House, and Tai Po Lam Chun Kao Liu Ha Estate Village, and then Tai Po Clover Garden and then Fu Hung Center. And then Shangshui Taiping Estate Ping Yi House, that's a suspected Delta case. And then Kowloon Chi Ching Estate Ching Yi House, Ching Yun House, Lam Tin Ping Tin Estate Ping Mei House, Choi Wan Estate Xi Yu House. These is also a suspected Delta case. And then Chi Hong Estate Hong Chun House, Chi Oi Estate Chi Oi Court Oi Chun Kok. And then in fact, the day before there was a restriction testing there. And then Yan Chao Street, number 68, Fuqua Street 148 Golden Building, and then Lai Tai House in Wah Fung Street, Hong Kong, and then Ting Honor Building at Shanghai Road, To Kwa Wan, and then Shek Lei Estate 2, Shek Yam House, Shek Lei Mok Shu Estate, Wing Shu House, Mao Wan Park Islands, Tower 12, and then Tin Chung Estate, Tong Yan Court, and then Willow House, Souok Estate, and then Hong Kong's City Gardens, Block 2, Pacific Palisades, Tower 2. And then we could see that 6 cases involve cleaners. Most of them are asymptomatic, or maybe they just suffer from a dry throat or a bit of a sore throat. Well, because it's easy for them to take the test, so that's why these cases are found. And these cleaners, say for Tai Wai San Chui, they handled sewage from restaurants, and or they involved in cleaning at the Science Park, landmark cleaning, and then Tuen Mun cleaning also in Shi Hong Estate. These are cleaners responsible for cleaning at these different locations. And then as I mentioned, there are 31 untraceable cases. These cases are scattered all over the territory. Many involved mild symptoms or no symptoms. So we believe, therefore, there are many transmission chains in the community, and we haven't yet identified some of the cases. Now, looking at the development, we could see that there are more and more untraceable cases, and from overseas experience is probably because Omicron is highly transmissible, so we could expect exponential growth of cases. So we are rather concerned that we'll be seeing more and more cases. We may be seeing hundreds or even more cases, and that may be a burden for our healthcare system. Now, we have seen in Tuen Mun there are some family clusters. We hope very much that during this period, please try to stay at home as far as possible. Unless it's necessary, please do not go out for gatherings or engage in too many activities, because the disease is spread from person to person. So, and then also there could be transmission in the air. So please work together to fight this virus. Thank you.
方面嘅情況。
Can Dr. Lau give us an update on the hospitals? As of 9 a.m., over the past 24 years, the HA system recorded 168 cases. Over the past 24 hours, another 53 patients recovered and were discharged, including the one case yesterday. Altogether, 12,880 patients have been discharged from hospitals. 1,246 patients are staying in the North Lantau Hospital, Hong Kong Infection Control Center, the HA's Infection Control Center, the Asia World Expo Community Treatment Facility, and 13 public hospitals. For case number 13400, her condition is still critical, and the other patients are all in stable condition. The floor is now open for questions. Please identify yourself before you speak. The lady on the back row, please. Good afternoon. I'm from Now TV. You talked about the case from Lemwu Home for the Elderly. For the patient who tested positive, what was her role in the elderly home? Did they engage in chatting or other interactions? Do you see the possibility of environmental contamination within the facility? You said that some cases arise from family gatherings. Were these instances in which family members had meals at home, or did they take place at restaurants? how many of these family clusters are we seeing over Chinese New Year, and how many people had to be quarantined or tested positive as a result? Yesterday, you mentioned that 2 persons who were on recognizance could not be traced yet. Are there any updates on their whereabouts? What is your assessment of the risk of spreading the virus in the community? In terms of switch testing in Shatin, a press release was issued yesterday saying that a number of switch samples tested positive and a number of people had to be tested as a result. How would you define the scope for switch testing in Shatin? Are you adopting a catch-all approach, and what is your evaluation of the results? The case you mentioned was a care worker. The patient knew some of the earlier confirmed cases, but they had no interactions, and as such, she wasn't classified as a close contact. We saw that in some prior cases, the relevant people had no interactions but still tested positive, so it shows the high transmissibility of the strain. They might be working at the same floor. So we saw a number of cases like these for the Omicron variant. In terms of family gatherings, the cases we saw stem from family gatherings at home. For instance, people who had meals at the homes of their parents, and that's why we saw some outbreak. I believe there are quite a number of these cases. As for the 2 persons on reconnaissance, we are still tracing them, and hopefully they could be identified soon. Earlier, some cases were found through compulsory testing arising from sewage testing. So these were cases in which they did not get tested, and I believe this is an effective approach to identifying more unknown cases. Next question, please. The gentleman on the front row. I'm from RTHK. And after patients are discharged, when they are under isolation at home for 14 days, they would have to be tested. Could they temporarily visit community testing centers, or would staff be deployed to take samples of these recovered patients at home? There are long queues for people waiting to be tested in Shatin today. Are you concerned that these people who get tested might visit other people's homes, and would that increase the chance of transmission? For Kwai Chung Estate, what is the latest total caseload? After patients are discharged, they do not have to be tested within 14 days. They would have to monitor if they display any symptoms, and if so, they would need to return to hospitals for checks. For patients who are discharged, their CT values would be above 33. So it could be possible that their PCR test results would come back positive. Testing is certainly an effective way to identify cases early. So for those who have to be tested, they should keep their masks on and maintain appropriate distance from other people and maintain personal hygiene. And during Lunar New Year, they should refrain from visiting others' homes. For Kwai Chung Estate, we do not see any new cases from previously unaffected buildings. There are a lot of close contacts in the estate. Altogether, there are 447 cases across 216 units. Next question, please. The lady on the back row. I'm from Commercial Radio. You said Hong Kong market would close early. How many confirmed cases actually visited the market, and do people who visited the market have to be quarantined? Is there an outbreak at the market? There are 2 confirmed cases from a stall at Hong Kong market. Of course, many people visited this market. So for people who had patronized the fish stall recently, they should get tested. But we would not put all visitors under quarantine. Next question, please.
Okay, so as there are quite a few places in Sha Tin, people there has to undergo compulsory testing, and a lot of people queue up. So is there a risk of spreading virus when people are queuing up there? And there are also quite a number of untraceable cases these days. So are the current social distancing measures enough in controlling the current COVID situation and also further outbreaks? And is there a need to further tighten social distancing measures with the rise of these unlinked cases? Thank you.
I think testing is a very good measure to early detect cases. So when people go to testing in the community testing center, they should observe the social distancing measures and personal hygienes. And for the untraceable cases, we've observed an increasing trend. This is not a good sign. It signifies there's quite severe community transmission at the moment. So I understand the government is closely monitoring the situation and will announce further measures as appropriate. 下一題，英文問題。
Next question, please.
CMP, a few English questions. Sorry, can I just confirm how many cases are detected at the Lam Wu home for the elderly, and what is the transmission risk for the elderly who are living there? And earlier on, one expert said that Hong Kong must improve the detection of untraceable cases. So I'm wondering if there will be more plans to hand out more, fast testing kits for the community, or is there any other way for the government to improve large-scale mass testing on a more regular basis, so that people don't have to queue up and long queues, or have some inconvenience when trying to get tested? Thank you.
For the elderly home concern, we have 2 confirmed cases from the community. I understand there may be one from the quarantine center. I need to double check. So the 2 carers, they were in different sections of the elderly home. So there are around 60 elderlies have to be quarantined, and they are considered as close contact. For the previous case, there were around 80 elderlies under quarantine. And I think currently the target testing is still a more efficient measure. So we try to identify any places or areas that people visited or they are considered as high risk, and ask people to go testing, both through the confirmed cases and also through the sewage findings. I think this is an efficient measure at the moment. And
I've omitted to mention, for preliminary positive cases, there are about 160. Next question, please. The lady in front. Yeah. I'm from Hong Kong 01. on sewage testing. You know, in Sha Tin, Tuen Mun, and many other districts, you have tested, you have got positive samples of sewage. Now you're asking people not to go around during the Chinese New Year. What about the sewage? How does it affect residents? How can residents avoid becoming infected because of the sewage, the contaminated sewage? And then for as a Shamshipo case, did you go and collect environmental samples for testing what is the risk of transmission? Because the person in charge mentioned that that is the temple there. They said that when people went there for prayers, they would take off their masks to wash their hands and faces. So have you found out about the number of people who went to the temple? Sewage was not that sewage could transmit the disease, but rather maybe the buildings do this, you know, in buildings there's discharge of sewage to a certain collection point, and then when we collect the sewage samples for testing, then we'll know if there are any positive samples. That means there could be cases in a particular building that we have not yet identified. But of course, if the sewage is collected at a particular location like a building, then of course we will be able to tell where there are cases. Now for a building, if there are positive sewage samples but there are no cases found detected there, then there's a cause for concern. That means that we have yet to identify the confirmed cases. So that's why we would ask residents to go and get tested. Hopefully then we could identify the cases soon, because these cases may be either asymptomatic or involve only mild symptoms, so people are not aware that they've been infected. So this is one way actually for us to see where in which district or which particular location there may be cases yet to be detected. For the Shamshui temple case, we are following up on that. We may have to quarantine some people if we find them. Next, please, the gentleman over at the back. I'm from Ming Pao. First, about a question for the hospital authority. For the AWE community treatment facilities, the isolation beds and wards in public hospitals and so on, what is the usage rate or the occupancy rate of the negative pressure wards and so on? And another question is about the cases of patients released on recognizance. Now you say they have to report tomorrow. Do you mean that they are required to report to a certain authority tomorrow? In that case, does it mean you have a chance of finding them tomorrow? And these two cases, where did they get tested? In which particular community testing center? What's the reason why they went for the test? Now, if you could find them tomorrow, it's fine, but if you couldn't, are there other ways that you could locate these two persons? For the Shamshui case, that temple, what are the case numbers and what is the strain involved? And you said that when they have when they pray that they have to take off their masks. So what exactly is the situation, and what is the risk of an outbreak there? Thank you. And now you mentioned the 6 cleaners. What are the case numbers? And is it the case that in this particular wave of pandemic, we are seeing many workers? Thank you. Well, I won't talk about the case numbers. For the 2 Shamshui case, they are suspected Omicron cases. And so far we've only found 2 cases that's been to that particular society or the temple or mosque. But then for others who've been there at the same period, they may have to be quarantined. For others who were there on the same day, they may have to get tested. For the cleaners, well, cleaning workers are now paying more attention. They are therefore taking the tests, and that's the reason why we found more cases. And actually, because many of them have only mild symptoms, so maybe they didn't go and see a doctor, they didn't get tested before. But now, because it's easy for them to get the test, and because they are paying attention to the situation, so they're taking the test, and that's why we're able to find these cases. Well, I've seen cases, the whole family actually have fallen ill, but it's not serious, so they just thought it's a seasonal flu. And then they didn't take the test, but then because one person becomes a confirmed case, then the whole family would get tested, and then all the cases are found. Well, actually, there is not much flu around in the community. So if you think you have the symptoms of a cold, or you have a sore throat, a fever, or a headache, it's more likely it is actually COVID. The Sham Shui Po case. Oh, the cases involving persons on recognizance. Well, we don't actually have much information to go by. They were tested in Kowloon, but why did they take the test and so on? Well, because we couldn't find them, so we don't know about the circumstances. But we have been using all the information we have to try to locate them, such as the addresses they leave behind, or the phone numbers and whatever. Well, there are 1,246 patients in isolation treatment at hospital authority facilities. About 500 plus are now in the Hong Kong Infection Control Center. There are about 800 beds, and so some 500 patients are there. For the AWE facilities, we have 1,000 beds, and there are about 440 patients. For the remaining patients, they are in the 13 public hospitals. That includes the Princess Margaret Infectious Disease Center. As for negative pressure beds, we have 1,178. Occupancy rate is about 70%. Apart from COVID-19 patients, there are other patients with infectious disease who require isolation treatment, and so they may take up the negative pressure beds too. We are now actively preparing for our Tier 2 isolation beds. In the past, we were able to provide about 600 beds, but so far we don't need to use these beds. For ICU, there is now one COVID patient that is in negative pressure bed in the ICU. And there are about 30 to 40 negative pressure beds in intensive care units that are ready for use anytime. And we have a contingency to say if more people need to go to the ICU, we could actually provide 100 negative pressure ICU beds. But fortunately, though, we have just one patient in ICU so far. But of course, if the pandemic becomes even more severe, and there are more elderly patients or the chronically ill patients, then there may be a stronger demand for ICU beds. So that's why if you are an elderly or you have chronic diseases, please do get vaccinated as soon as possible. That will reduce the risk of infection or the risk of a severe condition if you are infected. Because if you're not vaccinated and then you have chronic disease, then there is a high chance of complications and death.
Next question, please. I'm from Cable TV. Dr. Chuang, can you tell us the number of newly confirmed local cases again, and how many untraceable cases are there, and also preliminary positive cases? For the 2 confirmed cases from Hong Kong Market, did the 2 workers take their masks on during work? Were they infected while they were eating? Or were these 2 workers infected due to their families? There were 121 local cases, 90 were related to other cases, 31 were untraceable so far. we have about 160 preliminary positive cases. The 2 confirmed cases were employees. Whether they had any contact, this we would have to find out. For employees who work together in the workplace, typically it's easy for them to infect each other. Any other questions? If not, that's the end of the press briefing. I'm not quite sure. I'm not sure whether he had been tested or not.